Hello, everyone. My name is Boris Rietman, and today we have an English speaking show. Most of our shows are in Russian language, but today is going to be an English speaking show because my guest is an American bioengineer who is going to tell us something new and interesting about the topic of rejuvenation, particularly brain rejuvenation, because as we age, many things degrade, but one of the most important things, arguably, that degrades is our brain. If we can think, what's the point of living? And so I'm welcome to our studio Asher Raziel. Hi, Asher. How
Absolutely.
are you? So, Asher, you're connecting to us from Israel, but you're an American. You spent most of your life in the United States.
Yeah. I've been in Israel for about 2 years.
So, the natural question is why did you find that your research is most effective in Israel?
Well, I mean, it's a amazing research community here. Um, I don't know. I've been coming here forever, and I had a number of colleagues at a few universities that were doing some very interesting aging-related research, specifically with stem cells and with exosomes, and targeting the brain and senescence. And yeah, I thought it would be a good idea to come here and work with them on their research.
Okay, well, let's make a little survey because people who are listening to us or will be listening to a recorded version of this may not know the field at all. What is this rejuvenation? Is this something like women that they put nice cream and so their skin is nice and smooth? Is that what is meant by rejuvenation, or is it something more involved?
Well, no, I mean, of course, longevity. It's become kind of a buzzword, but it's essentially trying to develop both therapies and diagnostics. Diagnostics a way to measure aging in general, and then therapies to treat aging, right? To see aging in itself as a disease. All of the pharma industry, which is largely governed by the economics and the regulatory of how the industry works, has to treat like a specific disease state, and it's kind of constricted our ability to just develop therapies that treat aging unto itself. And they, by nature, right, a therapy that treats aging is just it's a preventative therapy, right? It's something that you'll take that will inherently prevent you from getting a disease, prevent you from getting sick, and then systemically over time extend your health span and optimally your lifespan.
And is Israel leading this effort, this regeneration? I can't even pronounce this. Is it leading this effort in the world?
I'd say definitely it's a leader. Sure, there's a lot of interesting research happening here. I mean, obviously, America is top. I
Yes.
know there's some really interesting stuff happening in Russia. It's a little more hidden, I guess. Japan is really advanced as well.
I heard the people saying that we are on the verge of a amazing breakthrough, and the world, this is the next big thing, that the world will never be the same. Do you think that we are close to extending significantly the human lifespan?
Yeah, absolutely. I mean, I think without question, certainly in this century, if not in the next decade or few decades, we're gonna cure, a lot of major diseases. Obviously, cancer, heart disease, genetic diseases. Um, you know, Inevitably, people start talking about anti-aging and living forever. And I don't know. For me personally, I don't get too much into that. A lot of people think it's important to think that way psychologically, but then a lot of weird ethical and spiritual things get involved. But yeah, I mean, I think we're at the dawn of a golden age in medicine and biomedicine.
Because the way that medicine works now, if someone is sick, how does it, how is the treatment generally? We have to cut it out. We can't fix it.
Cut what out? I mean, like
Well,
a
let's
like
say
a
something
tumor.
a person is sick. Let's say we cut out the appendix, for example. I don't know
Right.
much about medicine, but we cut.
Well, yeah, I mean, if an appendix ruptures, yeah, you got to go in and have immediate surgery to have that removed. I mean, something really interesting that's practically happening is CAR T or cell therapies to treat certain types of cancers, where you're able to essentially sequence a marker on the cancer cell and able to program. Then you then extract that patient's immune cells, and you're able to program that cell to essentially go find that cancer cell and destroy it. And we've essentially cured certain forms of cancer using that technology.
So it sounds like what I'm getting at is that medicine will become more targeted, and it will be actually able to fix things rather than, you know, to remove them, like, if I make myself clear, because spoke with one engineer who was in the medical field first, and then he quit and he switched to engineering because he said that when he was studying, he saw that they just cut things out. They don't try to fix it because maybe the technology wasn't there. But
Yeah,
to the level that we will have technology that can observe the problem and, as you're saying, tune the cure particularly for that problem and then fix it.
yeah, absolutely. Yeah, I mean, I think that's a good insight. Yeah, I think targeting is probably at the top of the list, of new innovations in biomedicine to be able to, target specific tissue types, cell types, and attack the problem like specifically.
And tell us a little bit about your field in layman terms, because I don't know much about the field, but I do want to live for a long time. So I will be
Yeah.
very curious about what's going on.
Okay, sure. So I mean, stem cells, everybody kind of knows what stem cells are. You're familiar with stem
Stem
cells?
cells is cell that can take any kind of shape. It can become any cell. That's the idea of the stem cell, right?
Essentially, yeah. And a lot of people talk about using stem cells for all different types of things, and nobody really fully understands, if you inject young stem cells, how that uh, kind of regenerates tissue or fixes certain problems in the body. I mean, what we specifically are working on and researching and developing is exosomes, and exosomes are these little small, like almost bubbles or extracellular vesicles that stem cells give off,
Hmm.
and those bubbles, to what you just said about targeting, are very good at targeting cells and specifically targeting the brain. They can get across the blood-brain barrier, and those little bubbles are filled with some cocktail of regenerative factors. Can be mRNA, microRNA, which is small chains, non-coding RNA that kind of manipulates the cell to do different things. They can deliver proteins, cytokines,
Let me
small
ask you this:
molecules.
mRNA business,
Yeah,
is that
that's not too much
is it,
layman's terms, I guess.
no? I think everyone now knows what is mRNA because of,
Yeah.
unfortunately, what we had to live through. But is this stuff that you're describing, is that new? Is this method new, or has it been used for a while now?
Well, I mean, whatever. People have been studying it for, I don't know, maybe like 15 years or so. There's a
Okay.
lot of challenges to productizing it and making it into a viable, accessible therapy.
Is that a scientific challenge or regulatory challenge?
I mean, both. Scientifically, it's difficult to produce these and scale them up. It's also difficult to qualify them and have a high level of reproducibility, meaning what's inside of the exosomes, essentially knowing exactly what it is and having it be the same thing, batch to batch,
Mhm.
because it's naturally produced by cells. You grow up these stem cells and they produce these exosomes, and then you purify them.
So I
Um,
guess instead of actually getting complete stem cells, if we can just get something that they emit, which are
Yeah,
the
and there's huge benefits to that, because there's risks with stem cells that, I mean, I think it's it's maybe, you know, not that high of a risk, but they theoretically can become cancerous. There's essentially no risk of that if you take exosomes. You can have some type of adverse immune response, and in virtually all preclinical work with exosomes, and also exosomes have a market. They have a gray market that exists where they're put in as a cosmetic for skin rejuvenation. But there's doctors in private clinics all over the world that inject people with these exosomes. And look, it's a weird gray market, but there's virtually no instances of people having a strong adverse response or immunogenic response to it.
Okay, I think I'm starting to get a little bit of a picture here, but let's maybe get a little bit of technical detail. Is that what's in the exosome in terms of molecules? What's in there?
Well, that's the thing. I mean, that with, you know, there's various mRNAs, microRNAs, proteins, cytokines. There's a lot of things, thousands, tens of thousands, which is crazy because these vesicles are only about 50 nanometers in diameter. And so there's two ways to look at it. One is that
50 nanometers is this, how large is a human cell, like a regular one?
It's about 25 micrometers. So
Much larger.
an exosome is probably anywhere from 100 to 1,000th the size of the cell. I think that's about right.
It's like a fish in a lake, inside the lake.
Yeah, right.
Okay.
And like if you were to take a dose of these exosomes, you would take a dose as like 10 to 15 billion exosomes or more.
So the idea is that the stuff inside these exosomes, if it enters a cell, the cell is very happy about this stuff. It's going to be working better.
Yeah, it helps to neutralize inflammation. It can carry molecules that we're seeing that can help stimulate neurogenesis, generation of new neurons in the brain. And probably the most interesting part of the research is it acts as something called a synomorphic. Do you know what senescence is?
That's, I heard this is the cells that don't die completely. Is that correct?
Right. They get old. They stop dividing. But they don't die, and they start emitting inflammatory molecules, and it's believed that's a huge cause of aging. And these exosomes act as a xenomorphic. They essentially suppress. This is technical. It's called the SASP, the senescence associated secretory phenotype. They essentially they don't kill the cells, but they essentially make them stop giving off bad molecules that have bad effects on the surrounding tissue.
Is these bad molecules, is that what people call free radicals? Is that what it is?
Yeah, free radicals is that, but like inflammatory cytokines also and proteins.
I see. Okay.
So there's two research paths. One is to grow these stem cells in a very particular, refined, precise way. And so we can kind of coax the cells to produce exosomes that have a particular cocktail, if you will, of regenerative molecules in the exosomes. And then there's another lane where you can just take the exosomes, which are, as we mentioned earlier, natural delivery vectors into cells for targeting, and you can then exogenously load a target molecule into that exosome, a target piece of mRNA or a target protein that you want to deliver.
If I understand, the first way is to create these exosomes which have something, but we don't quite know what. We just hope it's good for us. And the other way is to actually create a particular exosome with a particular thing inside it, which we plan that this is really stuff for this particular patient, for this particular illness. This is what he needs.
Yeah, I mean, honestly, it's we don't want the first one. I mean, that's the way it exists now, where doctors are injecting stuff. It's more like we want to know what's in it, no matter what. It's like one way is that we just naturally grow cells in a way that gets them to put certain molecules in. The other is that you purify the exosomes out, and then you load like one molecule in exogenously.
But that's It cannot,
Like
that
the
cannot be
technical way
much.
to do it is there's different ways you can freeze thaw the exosomes that will load the molecule. You can also genetically modify the cell line that's going to produce that target piece of miRNA or mRNA or protein and have that load in.
Well, I guess I have some stupid questions. I mean, it's kind of small. How is it done? It, it's not done by hands, right?
What part?
Well, let's say you want to load this exosome with something. How do you actually insert something in it?
Yeah, I mean, there's a number of ways. I mean, you can produce the exosomes, you can purify them, and then you can treat those exosomes in different ways that will load a molecule in. So you can freeze thaw it, like you do really fast temperature gradients that will
Mhm.
make the membrane open up and then allow the molecule to come in.
So it's kind of physical and chemical stuff. It's nothing that is done
Well,
actually.
no, then there's another way, and that's that you actually engineer the cell line. So you genetically engineer the cell line to express a molecule that it doesn't normally express,
I
or
see.
and then you have to add some type of carrier or tag to that puts that into the exosome.
I see.
And then kind of, I don't know if it's interesting, but I mean, just to map this to something that essentially everybody knows, which is this vaccine and the mRNA vaccines,
Yeah.
there is a lot of overlap in the kind of structure, which I don't know, people can take that in different ways. Some people
Yeah.
can see that as a negative. But I mean, so the mRNA vaccines were lipid nanoparticles, right?
Mhm. Yeah.
And
Exactly.
essentially an exosome is a natural lipid nanoparticle.
I
It's
see.
a, I called it a bubble or an extracellular vesicle,
Let's
but
explain
it's
to people what is lipid because it's a very fancy sounding word, but it's not in French. It just means fat.
yeah, that's really
Yeah.
all it is, and it
Yeah.
forms a lipid bilayer, and all cells and all vesicles have them, and they create this ionic structure that protects the inside of what's inside of it. And then when the lipid nanoparticle or the exosome comes up to like a bigger cell, it attaches to the membrane of the cell and then creates this opening, and everything comes inside of it. But the exosomes, because they're produced naturally by cells, they have a surface chemistry and structure that's natural and optimized for the body. So the cells perceive it as something that's part of their body, and they like bring it in. And not only
Yeah.
do they bring it in so it works better, but it doesn't create an immune response. It doesn't perceive it as a foreign body and create some type of negative response. And that's what happens with these lipid nanoparticles. They're a lot of
Mhm.
they're made out of polyethylene glycol or whatever, and they don't have the right surface chemistry, and so people the body can develop a negative immune response, and so a lot of people got myocarditis and all types of things from the mRNA vaccine.
Mhm. Okay. So if I understand correctly, the one that you described for mRNA vaccine was a lipid container, and this exosome is another way. It's not lipid, or is it still
No,
lipid?
it is. Oh, sure, it is.
It's still a lipid.
It's a lipid nanoparticle. Yeah.
Okay. Okay. So lipid
The
nanoparticle.
huge difference is that the vaccines ones are made synthetically and they cause a lot of problems in the body because the body perceives them as foreign, whereas exosomes are produced naturally by the body's cells. And so when you take them, the body loves them, it absorbs them, and there's no negative immune response.
I have a question from Jeff Samber, who is a friend of mine, actually. Um, and he asks, how do you get modified cells that are injected into a body to replace the existing cells? How do you get modified cells that are injected into a body to replace the existing cells? What are the general approaches? That's his question. I don't think we have answered this yet. We haven't. We talked about exosomes, talked about replacing cells. I'm not sure if it's something you can talk about.
Well, I mean, replacing the cells, obviously, I mean, I don't know if he's talking about like, bone marrow transplant. People pull the blood out and replace the hematopoietic stem cells.
Hmm.
I mean, that, there's special machines. One's called the Spectra Optia.
Hmm.
It's a apheresis machine. So it pulls the blood out of the body. It extracts certain things out of the blood. It could be the plasma, or it could be the red blood cells or the stem cells. And then those are replaced and then re-injected back into the body.
Well, I have a question that's kind of maybe is another silly question of mine. Is that it doesn't mean that every cell has basically a copy of my genome, right? My chromosomes, my 23 chromosomes, which are not exactly the same as your 23 chromosomes. Now, if I take a stem cell that came from somewhere else, I don't know where, it doesn't have that exact composition, and it's placed into my body. Doesn't it mean that I have cell from another with another set of uh, chromosomes? How does it work?
Well, I mean, I wouldn't recommend, I guess, doing that. I mean, we're just kind of going into a big biology lesson now.
Okay.
I'm working on exosomes. That's the whole thing. We don't want people to do, stem cells from other people because of that exact reason.
Mhm.
The exosomes are not foreign cells. They're these natural, vesicles.
But you produce them from the person who is being treated. It's his.
You can it's an interesting point in that, but like taking cells from the person, growing them up and extracting the exosomes and injecting them back in.
That's what
Um,
I meant. Yes.
we're finding though that the young cells, which are not going to be from you, they're going to be from a donor.
Yeah.
Um, they have the, like I mentioned, kind of the natural cocktail of compounds that are anti-inflammatory and regenerative.
Mhm. I
So
see.
you grow up, they're called allogeneic. You grow up the donor cells and then you extract the exosomes and then admit that to the patient.
Okay. Well, are there any projections? Let's say this treatment is, you know, produced at large enough volumes, so we can actually like try it and sell it and buy it. How long you think it will, by how much it will extend the human lifespan? Let's say now a person lives around 90 years, 100 years.
I think the highest form for this type of therapy, like this exosome therapy, I think one day it can essentially be like a supplement. People take like vitamin D or whatever, and it can literally get, I don't know if it'll get quite that cheap, but it'll get to that level where it's something that people just take regularly, and it's just regularly neutralizing
Mhm.
natural inflammation in the body and helping with neurogenesis and helping with senescence.
Mhm.
And if it's something that people take systemically throughout their life, I don't know what age maybe you should start taking it. Certainly probably past your metabolic peak, so maybe around like 40.
I
But if
see.
you start taking it regularly at that age, I think it could substantially reduce the incidence of various diseases.
Yeah.
And I don't know how far we can live. We like to say, Mea Esrim or 120. But who knows? I mean, uh, it does seem like we can push it. A lot of people think forever. There's a whole nother side of
Yeah.
the longevity industry. Obviously, there's all types of interesting research. A big thing is cellular reprogramming. If
Yeah.
you've heard about this,
No, not quite.
but
No.
it's essentially coming up with various proteins or transcription factors that get older cells to revert back into stem cells.
Yeah, I
And
think I heard something. This is would be actually rejuvenation, turning back to
yeah,
core.
but it's extremely dangerous right now, and it's going to be a long time before we have a therapy because it can turn the cells into cancer very easily.
I see. Okay, well, this was part that we touched upon that is, as you call, a biology lesson. But unfortunately, everyone understands tech and bits and bytes, but not everyone understands this stuff. So
Yeah,
I wanted to talk with you about this because you do. This is your specialty. But now we are also joined by Gregory Magarshak, who is in tech, just like you, because we'll touch in a moment that you are doing this through the crypto in a crypto way. So we're also going to bring Greg into our conversation, and we'll switch slightly gears and talking about crypto stuff. All right, Greg, I hope you're ready. I'm bringing you in.
Hey guys, how's it going?
Hi, Greg. So, Greg, as you have probably heard the last 2 minutes of our conversation, we talked about biology, but Asher is fine. You are yourself an investor in, and you are receiving investments from the decentralized and blockchain. Please explain how does it work.
Talking to me?
Yeah, Asher. Yes, yes.
Yeah, yeah. Yeah, I mean, I've been just a personal investor in crypto, and then this subset of crypto, this sector called DeSci, or decentralized science. And yeah, a lot of amazing people that have been developing some cool stuff the last number of years, and it's a crazy time right now because Trump got in, the markets are taking off, and DeSci is really kind of having a moment, and hopefully it'll really continue for a long time. And I mean, yeah, I've invested in a number of the DeSci companies and tokens, and yeah, we're looking at fundraising through that channel as well.
Mm. Greg, do you know about this decentralized science as part of your Intercoin activity?
I- Well, yeah. So, hey, Asher, nice to meet you. Um, yeah, I mean, I've been in the decentralized space. I like to say since before it was cool. You know, I was in Web 2 decentralization. My first company, we built a decentralized social networking platform because I felt that people need to have their own social networking ability. Living in Instagram's world or Mark Zuckerberg's world or Elon's world, you don't have your own. So I was very much into self sovereignty. And then when the Ethereum and the smart contracts came along, I built Intercoin. I spun off this other company. So I've seen DeFi. I've seen DeSo, which is decentralized social, but DeSci is a little bit new to me. I definitely know there's people that want to tokenize patents and research, so you can invest in something and get money later when the thing goes to market. So, yeah, is it like sort of a launchpad type of approach?
Asher.
Yeah, yeah. I mean, right. The kind of cornerstone up until now, at least, is this idea of tokenizing intellectual property, tokenizing IP, and then essentially fractionalizing governance over that IP, right? And so there's these DAOs, and they have these intellectual property tokens. And I mean, it is a bit complex, but they set up these associations that then have legal contracts with universities or companies, and then they are stewards of that DAO, and they sub-license that IP to an IPT or IPNFT.
Mm.
Then they have these DAOs that have token holders, and the token holders, are able to vote on how to spend the funds. And there hasn't been any type of commercial exit, I guess, that absolutely proves the model. It'll be really exciting. Inevitably, that will happen, because obviously these tokens they're not ownership shares. They can't be securities. They don't like actually own the IP. So say some piece of IP gets sold to a pharma company or licensed or whatever, and there's a huge, influx of capital. What happens to that? Can the token holders then vote to get access to that? We have to see how that's going to play out.
Well, it sounds like you're raising an issue with the system. I thought you were a big advocate of this decentralized approach.
Well, I mean, yeah, I believe deeply in it and the ethos. And I mean, there's a lot of problems in the broader pharmaceutical industry, from how the patenting system is used, and the incentives and the way the FDA is run. And I love the ethos of the guys who are building these platforms. And they're trying to democratize and decentralize science, and get more research funded, and make the markets more liquid, and ultimately bring more money into it.
Wow. Isn't
So
it?
I have a lot to say
Go ahead.
about sort of the two sides of this. 1 second, I apologize. There's a
Well,
train actually that's over here. I figured
we'll wait for the
I'm in an
train.
interesting area actually of Miami. So I am normally from New York, and I'm just visiting here. So I said, let me join.
Thank
And
you for your
yeah,
finding the time.
so
Go ahead.
I deal with all kinds of tokenization. Right now, I'm going to be at our Dazzle. I'm going to be tokenizing art, and there's going to be auctions and price discovery of different art pieces. So that's what I do. But I geek out on the tokenomics part, the decentralization part. I think it's very important to democratize things. I think Boris and I we discussed in the past, right? Okay. On the one hand, can you guys hear me? By the way, I
Yes,
apologize.
yes. Go ahead. Just ignore the sound. It's fine.
Okay.
Go ahead.
So on the one hand, you have intellectual property ownership, and I think it could be an interesting discussion, Boris, because you also you follow objectivism, right? And Ayn Rand.
Yes. Yes. Good. Yes. You know
And I
this.
think there's a debate in the libertarian community about intellectual property, whether you should be able to own ideas, and have sort of a boundary around if people have the same idea, they have to pay you. They have to pay you because you had it first. Um, and I think there's interesting arguments because I do think copyright is something that it has more legitimacy, perhaps, and then there is trademarks, which I think have complete legitimacy because you want to prevent others from impersonating you. So that type of IP, I'm fully on board. With patents, as a software developer, it's certainly been a contentious thing because the software industry moves so quickly that patents are almost not needed as an incentive. And if anything, they actually retard innovation in software by creating these risks,
Yeah.
these landmines, if you will.
Yeah.
Who knows? There could be a patent troll somewhere to go after you. So it's an interesting question about intellectual property, but I will say now with decentralization, people can own a small part of something, not necessarily owning the whole thing. So no one owns Bitcoin, no one owns Ethereum as a network, right? Whereas Elon Musk owns Twitter in a meaningful sense. He controls everything about it.
Yeah.
And Mark Zuckerberg owns his thing. So I think it's important to explore with science how people can make money, but not necessarily by preventing others from also doing whatever they want. I don't know. So what do you guys think about that economic
Yeah, I mean, it's interesting. Obviously, I love it when Elon Musk says that they release a lot of their patents, and I think I saw something recently. He thinks patents are bullshit. They slow progress, and they're not that helpful, but they're necessary, right? I mean, as far as IP in the scientific world, and back to the kind of DeSci idea of making an IP token. What will actually be the IP, I guess, is the question. Will it be a patent filed with the patent office, or will it be just a lot of data, that's accumulated by a researcher and in a clinical trial? And then that data can be somehow, packaged and held inside of that NFT.
Well,
that's the other thing I want to. Sorry, Boris, go ahead.
I did post the links that you shared in our private chat. I posted on the YouTube.
Yeah, real quick.
So
That's
everyone
just those are the bio XYZ is like kind of they just raised 50 million, and they're going to be like an index fund of all the different DeSci DAOs and tokens, and they're also going to act as like an incubator, kind of like a YC. Give checks to new DAOs to start. And then Catalyst is probably the most interesting. They're just a crypto crowdfunding platform for scientific research, and it's crazy. There actually was one on there that just went live like an hour ago. It's the Nisi Ovaria one. They're trying to do some AI discovery for fertility research, and they raised 82 ETH in 30 minutes.
Mm-hmm.
And
there's
I think there's a big network effect. I've seen projects that have a celebrity or a famous scientist, right, or something like this, and they raise a lot of money. And I will say, until tokens came out, I think it was a far superior model. This is my own uh, opinion, open source model. So, like, open source is based on how science used to work, which is scientists used to be working at universities. They got a steady paycheck, a stipend, right? But many of these scientists, they might have been jazz players on the side or whatever. A lot of Russian composers in the 19th century were uh, scientists. But I will say this: they made science, they gave it away. Like Jonas Salk with the vaccine, he didn't want to patent it, he gave it away. That's very rare. Um, in pharma, that's very rare. But in the rest of science, in the rest of the scientific establishment, other than pharma, it's very common. In fact, there's a race to publish and give away your discoveries for the prestige of being known and being named after you. So Einstein's theory of relativity, he won the Nobel Prize for Brownian motion, his work on Brownian motion. Then he had the general theory and the special theory of relativity. I guess what I'm saying is scientists have a gift economy, you could say, because there's a venture capitalist whose name is Albert Wenger. He's in New York. I knew him like 10 years ago, and from time to time I speak to him. He works for Union Square Ventures, the guys that invested in Twitter and so on. And he has a book called World After Capital, where he talks about how digital goods and knowledge have zero marginal cost of copying it. You know, like Thomas Jefferson said, when you light a tape or a fire at mine, I don't lose anything, right? You get a fire, I get a fire. So he was talking about intellectual property. What I'm basically saying is, in science and open source, most of the wealth was created by giving it away. Linus Torvalds gave away Linux. Tim Berners-Lee gave away the web protocols, and trillions of dollars were made. But now with tokens, I feel like the original founders can actually find ways to make money if they can make a network effect. So like Ethereum has a network effect. You're paying miners in ETH, and ETH has a lot of value deposited. And that's why the NFT people are using ETH rather than Base or Optimism or something like that. So what I'm saying is there's a snowball effect that when they solved the double spend problem, they were able to transfer value online, and suddenly there's not any more zero marginal cost of copying. It was so easy to copy that they actually had to solve the problem of preventing copying, and that was a double spend problem. So I guess what I'm saying is now you can have scarcity online, but just be careful, because most of the discoveries that the world has benefited from, they benefited because they were able to build on top of those discoveries with no permission. And if you have a patent and you're requiring permission, right, from people to build, and what if they don't want to? So what are they? So, anyways, these are just my
That's
thoughts.
an interesting take. I mean, what's your instinct though about what's happening in DeSci?
My instinct is anything that builds a network effect, like Facebook has a big network, they're going to be able to leverage that into a token. That's ultimately where the value of any currency comes from, is the network that will use that and recognize that currency. So to the extent that they can do that, token's going to be worth money. But in terms of restricting other people from using the discovery and using the government to try to go after them, I don't necessarily think that that's going to be a very provable model, because that's my opinion, because there's so many risks. What if the patent gets invalidated? What if there's prior art? What if this and that, the other thing? The judge feels differently. So I just feel like if they focus on the network effect and building that network lock-in the way that Ethereum gas fees are paid in ETH, then I think it could be that's my take on it.
Well, let me ask you now a question.
What do you guys
First of all, I will not debate now with you about the merits of your. I can only just say I disagree. I disagree about the idea that intellectual property should not be patented. But we're not going to go there now. But I want to ask you about the network effect you're saying. Facebook and Twitter have been around for a while. Telegram now has its own cryptocurrency. The question is, well, are these things successful in any kind of way? Facebook, for example, I mean, I understand the social interaction and putting likes and so on, but where does the money come in? Where does the money come in Twitter? I mean, I understand that if I'm paying for ads, that's money. That's money that Facebook makes. But I don't see that Facebook by itself having an idea behind it. Decentralized science is the idea that, okay, we're gonna find science, we're gonna make money out of science, right? Decentralized, I don't know, but social, but science is more clear to me. It's just an investment vehicle. There is an idea that unites people, but how does Facebook unite all the Facebook users? I don't quite see that happening, and I don't think that Facebook is going to become a financial powerhouse in terms of coming up with a currency. They tried it, that didn't work for some reason.
Well, I'll tell you, and then I'd love to have a discussion about this. What do you guys think? So,
Yeah.
Facebook, I think, could easily roll out a currency. They were stopped by multiple agencies of multiple countries when they were trying to do the Libra. Telegram was sued by the SEC. I don't know why they stopped. I mean, they did everything by the book. They sold it under Reg D to millionaires. Their smallest investment was $1 million. It doesn't seem like they, flaunted securities laws. But regardless, there's much more powerful agencies than the SEC. I mean, heck, the Congress said that the Libra is a supranational currency. They don't want to see that. But look, at the same time, you got Bitcoin. We don't know who Satoshi is, and that's a supranational currency. So if there's no one to go after, then they can't go after them. But I guess what I'm saying is,
But
Facebook didn't
Bitcoin is
stop
not a
because they
social
couldn't.
network. But
Sorry?
Bitcoin is not a social network. There is no other product around it.
You're right. So look, first, I think that Bitcoin was the first. When something comes out and it's new, then it gets all of it spreads fast. Like the novel coronavirus. It's just a joke, but it's true. Then people didn't have immunity to it. Now, if I make a clone of Bitcoin, no one's going to care. Just like if I made a clone of Facebook, no one's going to care. From 2006, right? You constantly, people are expecting more. So what I'm saying is that today, if you have a social network like Telegram, you can launch grams or stars, which they did. They launched Telegram stars instead of grams. And then now they have the TON network, and they build it into everything they do. They have 1 billion users. It's very easy to push anything. Facebook the other day made a new tab called Local or Dating. And overnight, everyone has that tab. So they're going to check it out. They're going to see what's there. And the network effect is there because, I mean, this is what I do. So I can go into the mechanics of it, but essentially, if you arrive at the new tab and you see a lot of stuff and you see your friends are using it, even if it's fake in the beginning, you're going to, with a certain probability, use it too. And these things can be mapped out. So there is a definitive numerical answer as to whether Facebook can launch something. And currency, yeah, it can launch a currency. It was just the government didn't want Facebook to launch a currency.
Right.
They were threatening it.
Well, the question is, can Facebook, for example, help develop the rejuvenation therapy? And I don't think it can, because it's
no,
not.
I don't think they're in the business to do that. No.
Right. And that's what actually the stuff that matters, because if we can fund and sidestep somehow the regulations that restrict development, and Asher, I want you to chime in here, is that you went to Prospera and you did some research in Prospera, right? Because
oh, cool. Yeah, you read my mind. Yeah, I just wanted to talk
go
about
ahead.
that.
So go ahead. Why did you go there?
Yeah, so I mean, with crypto's application to biotech and research and longevity, there's obviously this interesting IP angle and getting the funding in. But then there's this idea of the trials and the regulation, right? And the FDA is notoriously very, very problematic. I mean, like, I'm not like an anti-FDA guy like a lot of people are, but I would prefer to disrupt it. It's cool that Trump's got these guys in like Vivek, and I think they'll make some changes. But anyways, yeah, to your point, 3 years ago, I went down with the guys from the gene therapy company, and I was living with them in Austin, and they had this plasmid gene therapy, and we went down to Prospera and Roatan. And obviously that's how we met, right, Boris? Or we were through that group?
Maybe through the
Carter
says
City. You never went
group.
there,
I
but it
did
was
not
through
go
that.
to Prosper. No, I did not go. But
Yeah. It's been crazy to watch what's happened the last few years. But yeah, we went down. I don't think the Prosper leadership was necessarily thinking medical so much. It was kind of on the back burner, but we went down there and pitched them the gene therapy, and they liked it, and it was very safe. We'll say very safe. And then we went and met with a stem cell clinic that was on the island, and they had an IRB and sponsored the trial, and those guys ran a inhuman phase 1 clinical trial there on the island, and a very small fraction of the time and fraction of the cost compared to if they had tried to go through the FDA. Who knows if they would have even gotten approved for an IND.
well, I guess what would be interesting to find out is not just a trial, but we're seeing actually like a success story saying, look, here we came up with this medical cure or something or vaccine, and it's done. It's a done deal. It's working, saving lives. But if we were trying to do this in an existing country like United States or Israel, I don't know. All countries have these regulations. We would have failed. If you could have showing these examples, I think yeah, it's going to give people a lot of pause. But so far, we don't
Yeah.
have a success story yet, right? We just
Yeah.
have progress.
I just wanted to say, yeah, I went to Prospera a few years ago, and I got to know the people. Nick Anzinger, they're very active there, and
Yeah.
Vitalik sometimes comes, and they have the longevity things. Last time I was there, I think was this year in the summer. They had a bunch of startups. They have like an accelerator, and they try to bring. They had Brian Armstrong, one of the judges, I think, and a few other things like that. So, and then later I was in Singapore. So Brian Armstrong and Balaji Srinivasan, they
Yeah,
ran.
you went to the network school?
I didn't go to the actual network school, but I met a lot of the people. I went to the Network State Conference, which was right before that.
Because the network school thing, it's in this abandoned thing, like actually in Malaysia, right? It's like this
That's right.
crazy construction village that some Chinese company abandoned, and I don't know the details, but
No,
seems
that's exactly right. It's $100 billion. They built it. It's a ghost town,
so
and
yeah.
it's a great deal. Balaji probably bought up a lot of it. I mean, look, I met people from Liberia. The people from Honduras were doing this 10 years ago with the charter cities. There's a movement to try to make these charter cities, these developments, where they have sovereignty so they can do the kind of research you're talking about.
Yeah.
So I think there's going to be more of them coming down the pike.
There's
Yeah,
one
so
thing that we have effort by Patrick Friedman with having like floating ships or floating platforms, but the most simple one that exists now is a ship or a cruise line where you could maybe do this kind of research because it doesn't require medical work, doesn't require a lot of physical space, does it? It's all like in a lab, it's all small. Is that true? You don't need a
Yeah,
big
Usher, why not make like a cruise ship for
yeah,
medicine?
I've definitely heard that idea a lot. I thought Brock Pierce, obviously you know him, right? I thought he got a cruise ship and was going to try to do this whole floating crypto city, and people would be able to get whatever treatment they wanted.
Yeah, as far as the crypto, I mean, it's just for me, it sounds like just a cool thing that everyone wants to get on board with. But I can see that a ship that can do this medical research is a tangible product. It's a physical product that okay, now we have this treatment. You can we can produce it at some volume on the ship. We can have people come to the ship, receive the treatment. This is something that's not really available in any country, even in Prospera, because there are some regulations there too. You can't do whatever you want, right? With as far as medical research is, so I think if there is a viable plan with the network state idea of having maybe like a virtual country that is actually physically floating. I mean, Network states is the idea that you're going to have like first virtual countries, and then eventually it will find some land. But I think if you can actually have a floating boat, floating ship, and that ship does medical research, then yes, no other industry I can see think it can actually exist on a ship because it requires more space, it requires production. But I don't know much about medical. It just seems to be that it doesn't need that much space. You can do it in a what do you call that room? What's the term in English? Room on the ship where you sleep. We have a term in Russian, kayuta, but I don't know how that's. By the way, Greg, do you speak Russian?
The hold. Yeah. Yeah. Oh,
Okay,
I know what you're talking about. The suite. Yeah. And
a suite, exactly. So you could probably do a lot in a little tiny suite
cabin.
on the ship.
Yeah.
You could also
Well,
code. You can write code, but programmers pretty much have been unregulated. They are unregulated.
yeah. So this is. I just wanted to say, as we record this,
Yeah,
yesterday there was a ruling about tornado cash. So, the Office of Foreign Asset Control is what we have here in the United States in order to prevent money laundering and sending money to terrorists or countries we don't like. Countries we don't like include Iran, North
yeah.
Korea, and interestingly, Cuba. I don't know what threat Cuba presents to us, but it's on the OFAC list to some extent. Um, and so, and so, if I deal with people on the blockchain and they happen to be in North Korea or Iran, um, the question is, can they send me money? And what the appeals court determined yesterday is that the smart contract, in this case, there was the Tornado Cash smart contract, is not under the jurisdiction of the Office of Foreign Asset Control because they said it's not property. No one can own it, no one can control the smart contract, and therefore, whatever it may be, it's not property, and therefore, this office cannot prevent, you know, I guess from being used. It's a very interesting. Sorry about that. It's a very interesting question because the programmer who wrote the code to Tornado Cash was found guilty and put in prison for 5 years by his country, the Netherlands, I think it is. And they have different protections for freedom of speech there. But they put him in jail not for um, writing the code, but for deploying it and running it and making money with a venture capital firm or thinking of making money while not putting in any safeguards for money laundering. So what's interesting is a lot of crypto can enable um, transactions permissionlessly. It's almost too good because it can enable countries that we might not want the people to transact because they're regular people, but it might enable that. But what happens is Tornado Cash concealed is used to conceal a lot of these things. Now, if they're in the open and you can see who's transacting and everyone does KYC, it's an interesting question now after this ruling whether these smart contracts are a new kind of international waters in the sense that they're not really subject to OFAC's jurisdiction. So the question becomes, can they be used for commerce? Anyway, it's a very interesting question. Um, and his co-founder in the United States is scheduled to await trial in December. So we could see what happens with his co-founder. He's facing 25 years. Maybe he'll be exonerated. Anyway, it's a very interesting free speech question because these are developers who developed Tornado Cash. And the question is, what's the liability of developers of the software as well?
Yeah. Asher, do you think that the government should be controlling the financial aspect of the decentralized system? Let's say someone invests in your startup through this DeSci and you do not deliver and the money is gone. So should there someone be controlling or regulating this, or it should be laissez-faire, which is what I advocate, but I want to know what your
Should there
thoughts.
be like a global organization that polices it to some degree? Yeah, probably, down the line. I mean, when you say the government, what do you mean?
Well, you are based in Israel, so I guess that would be the Israeli government. checking what you're doing there. Or if your investor is
Well,
in the American government, maybe it will be the American government protecting him.
well, I mean, it's a bit of a touchy thing. I mean, with crypto, like, I mean, technically Americans, can't buy these tokens. A lot of them end up buying them on a VPN.
I see.
Uh,
Well,
you know,
because
and the,
a lot
this
of people actually lost money, right? We had this scandal. Fry, Sam Bakeman Fry, can't remember the name, but a lot of people lost money because they entrusted the money to his exchange, and that he invested in some unsavory projects that failed. Is that what happened?
Yeah, I mean, Greg probably knows better. I'm not sure. They had an exchange and they were offloading their clients' funds into some weird hedge fund thing and lost a lot of it.
I can speak to that. I could definitely speak to.
Yeah.
This is the thing. Blockchain was originally designed to disintermediate, to remove the middleman, the banks, right? The people who would rehypothecate your money and lend it out. And these guys made the banks look like Boy Scouts. So what happened is 2008, there was a crisis. People were very receptive to a currency you could not inflate, these kinds of things. And in waves, people joined Bitcoin. And back in the old days, I feel like such a grandpa talking about the OG days.
Yeah.
Dogecoin, even Dogecoin and Litecoin, all these things, you never thought they could rug pull you because the network had one coin and there was one protocol and we all knew what it was. Then came Ethereum, and Ethereum allowed any script kiddie with, just copy paste the contract to create their own. That's a different world because now, yeah, you don't trust the banks, but the developer of the contract could rug pull you. So you needed to audit all the contracts. So there emerged things like Uniswap and Aave Marketplace that were audited, battle tested, and billions of dollars were put in there, and not a single time were they hacked. As far as I know. So those are bulletproof smart contracts, as far as we know. Very nice. Like Bitcoin, they can be sort of trusted as these decentralized, newfangled ways of organizing our money and transactions. But then came these guys like Celsius. I met Alex Mashinsky. I think he's also from Israel, right? Originally, and some of his partners. There's Alex Mashinsky, and they wanted to make Celsius, which was lending money. That's what they did. Sam Bankman-Fried, he was very well connected. His parents were like lawyers, whatever. He got a lot of money from VCs and people who wanted to make a quick buck on exchanges. Now, look, an exchange is great. I believe in decentralized exchange, like Uniswap, right? Like all these things. But when you make a centralized exchange, even Binance, right? Most exchanges, you trust them. You're going back to trusting someone to not do bad things with your money. So you're literally giving over your crypto, sending it to them. So I would say the only crypto thing about FTX and all these guys was that they accepted crypto and they paid out in crypto. But internally, they might as well have had a database. And in fact, Sam Bankman-Fried used QuickBooks and he didn't have a CFO or something like this. I don't know. It's just all, that's who you gave your money to. He was playing video games, and the VCs were very impressed by the fact that he was gaming while he was talking to them. I think that's a set of incentives that just shows how much of a mania there was. And then, of course, one last thing I want to say about that. There are stable coins, which are algorithmic stable coins, which try to manage the value by restricting the supply. But they forget that market value is a function of supply and also demand. So when demand drops and you just increase supply or you decrease supply or whatever, if no one wants your coin, it doesn't matter what the supply is. So this guy from Korea, Kwan, his last name Kwan, I forgot, Do Kwan, I think, he made Terra Luna, and it was the biggest crash of a stable coin. Because again, everyone seemed to want to invest in this kind of stuff.
Yeah.
And that's what brought down Three Arrows Capital. That's what brought down Celsius. That's what brought down FTX and so many others, including Gemini's yield thing and so on. they all got in trouble because they were promising yields in a bull market, but when the market turned into a bear market, you can't have these yields. It's crazy. So I'm just saying, these guys are not crypto. These guys are not blockchain. These guys are blockchain adjacent, where they say, we accept your crypto, give it to us. And that's where the decentralization ends. Anyway, those are my takes on
I
that.
see. I see. Well, I want to kind of raise the point, connects all these ideas we've been discussing, is that I see a lot of people who are interested in the crypto, into decentralized stuff, like you, Greg, like Asher. Um, and at the same time, I see pretty much the same people interested in the medical research, in rejuvenation. And my question is this an accident, or is this because the medical research is trying to escape regulation in the same way that the finance people are trying to escape
Well, I
regulation?
mean, no, it's not just like escape the regulation. I mean, it's a similar ethos of wanting to be liberated. You know,
From what?
it's that
Liberated from what?
From death.
from death. I mean, the pharma system is heavily bloated and I don't want to say corrupt. You know, a lot of people will say that. I won't say that, but it's in the business of people being sick. You know, it's not health giving. It's not liberating of people's health. I mean, just look at the U.S. I mean, I don't know the number, how much the U.S. spends on healthcare, and people are extremely unhealthy. You know what's going on there.
Yes.
And I think that the core ethos of crypto, of course, there's been all these bad actors, like there isn't anything new for sure. But the core ethos that drives it is a good thing. It's liberation, it's freedom. You know, those are
You're
things that we
saying
all
that
want.
the research you're doing, you could not do it as part of the existing
But of
investment.
course I could. I mean, it's different incentive structures. I've raised venture capital. I raised that in a former biotech company. And it's just a different model where it's really locked down and constricted, and everything's about filing patents, and you need to get 1,000x for your investors, and you have to overhype it to get to the next round in this very small constricted pool of venture capitalists. And crypto just kind of, it just kind of opens it up. I mean, it's still problematic, right? Because these tokens are governance tokens. They're not a share. You don't have a right to profit
Yeah.
through it. They're trying to figure that part out. I mean, Boris, you seem skeptical, or are you just asking questions from
I
that
am I
perspective?
am skeptical about the whole crypto sphere. I did arbitrage when the early days, as you, Greg, say, the old days of Bitcoin. I mean, I did arbitrage there. I never held it because I didn't know what's gonna happen. I am not a player, but I did arbitrage because I saw that this is a sure thing. I'm making money. But as you say, it was a bull market. In the bull market, many things are possible. You cannot do it in a bear market. Or in the level market. So but then I continued observing this when Mt. Gox crashed. That's when I stopped doing arbitrage because a lot of my money got stuck there. And
Oh, wow.
I waited for a long time to get it out, and I got it out, and I made profit, but modest profit. But the point is that I do not like any kind of bureaucracy, whether it's coached in the old-fashioned, pen and paper terminology, or if it's framed as bits and bytes. It's a bureaucracy nonetheless. And I like the hacker culture. I want to get there. It's like the Facebook motto. Try and break things. How does it go? Something like that. I want to break things, take them apart, put them together in a new way. So I think that in some way, maybe coders and programmers, they have that kind of approach. They just want to get things done. They don't want to go through all the paperwork. And it sounds like to me, Asher, you're saying that yes, it's just easier to get things, try things, because we don't have to play the financial game that we have to play when we go with the standard approach. Doesn't sound like what you're saying?
Yeah, that's sure. That's absolutely part of it. But it's not about like cutting corners. It's about still doing it legitimate, but getting the bureaucracy out and freeing up the capital And yeah, I mean, creating potentially an even a better regulatory body than something like the FDA.
Well, because yes, I think maybe one of the reasons once the regular big pharma is difficult is because it's highly regulated. It's heavily regulated. It's everywhere regulated. So maybe that's why you had to jump through a lot of hoops when you were raising money the standard way. Is that possible?
Yeah, it's that. It's also the patenting system. You know, the biotech industry almost completely revolves around that as a business model. They invest in developing research that you have to file a patent and then you have to license that to one of the big pharma companies or get acquired. You know, so
Yeah,
there's
I want to.
Yeah,
Sorry,
go ahead.
yeah, I want to speak to that because I think we have three different perspectives here, which I think is awesome. Boris, I want to talk about the other aspect of what Asher mentioned, which is democratizing investment into these things, right? So when I was growing up, I saw the venture capitalists and funding the Web 2 kind of startups, Google,
Yeah,
Amazon, Facebook, right, all that
yeah,
stuff. And a lot of these guys are very much about winner take all and monopolies. In fact, Peter Thiel, who invested in Facebook, he has a philosophy that says competition is for losers and you should build a monopoly in order to extract rents and capture value. Okay. I'm not putting words in his mouth. This is literally the title of his op-ed piece in the New York Times and other things. It's much more nuanced than that. So I don't want to say that he's just being, a cartoon villain. But he does work with government a lot. For example, just to focus on Peter Thiel as an example, because he's a proponent of many of these things of build a monopoly. Mark Zuckerberg, before he met him, was an open source guy. He built Synapse, gave it away. He wanted to build WireHog, a peer-to-peer open source system. He was dissuaded by Sean Parker, who introduced him to the venture capitalists. Sean Parker was also building Napster, and he learned very early on that the music industry doesn't like it when you give away their stuff because they have intellectual property. They went after Napster, they closed Napster, but now we have BitTorrent, right? We have all these decentralized things. So he made Mark Zuckerberg realize that you can play the game of building a centralized company, having investors invest in it, and of course, sell it to the public. But once that happens, the public expects profits every quarter, every shareholder meeting. They want to know, how are you going to be extracting rents from your ecosystem this year? More ads, more surveillance, more whatever, right? There's got to be a way. Whereas with tokens, yeah, just to finish up with Peter Thiel. So Peter Thiel works with government. He built Palantir for pre-crime police departments. He helped to get JD Vance elected right now to become potentially our next president. If if something, God forbid, happens with Trump, he's the vice president. So he's very active. He's active in the same way that, for example, Kolomoisky was active in Ukraine when he helped Zelensky get elected with that show, the show called Servant of the People, right? Everybody knew Zelensky through a show that was produced by this
yeah,
billionaire. So,
yeah.
and then last thing about Peter Thiel is Peter Thiel also started the run on that bank, Silicon Valley Bank. It was in the news last year, and what's interesting about that is half of all the startups and the VCs banked at one bank. So it's a highly centralized system. They invest in specific startups, they decide, and everybody banks at the same bank. That to me was the kind of the symbol of the centralization. Whereas here it's democratized. Anyone can buy into a project they believe in. Anyone in the world, and they're almost like disrupting the
But can't you do
old
this
poison.
now? Why can't you do this now? Why can't you buy private equity, or if you have money, or you can just buy private stock? There are companies like Our Crowd in Israel. Asher, have you heard of this? Our Crowd, they're based in Israel. You can
Yeah.
invest into small startups the same way. I mean, I don't. I'm not a finance guy. I don't know. Maybe the decentralized stuff is actually more efficient. Maybe there is less fat margins there in terms of like what you have to pay
I'll just
left
say
and
for
right.
5 seconds, sure, just 5 seconds. under Obama's administration, is something called the Jobs Act, where they directed the SEC and the Congress directed them to make crowdfunding a legal thing. Before that, it was not legal in this country. So since 2014, only 10 years ago, you could start to crowdfund for projects, and I absolutely love that. But I just want to say it's only recent. It wasn't allowed by the U.S. government.
Well, let's add to the fact that when Obama signed that, he signed it so that he could tax people who collect money this way. It was, he considered it's not good that people actually have an idea, collect money to develop the idea, which is what the decentralized stuff allows them to do, which is a kind of crowdfunding. And if you think about it, he said, well, if you're going through, what is that website? I forgot the name of the website that allowed to collect this money. And then that the person collecting, let's say he collects 100,000, 30,000 he has to give away to the government. And it's really sad. So now he has 30,000 less to develop his project.
Boris, what do you think's going on? I mean, Brian Armstrong, biology, but Brian Johnson, all that. But a lot of these people who want to essentially use crypto, and they want to fund research. They want to fund these startup cities. What's going on there, you think? I
mean, well, now that you ask, thank you. First of all, we do have to finish up because we usually go for 1 hour, but he'll just go, 10 more minutes. So what I think is going on is that there is several factors. First, there are people who are holding Bitcoin. So it's in their interest for Bitcoin not to drop. So they spread a lot of propaganda that is pro-crypto propaganda. That's one factor. Another factor is that it's a pretense at freedom. So you have a regulator. I'm not going to go into names, but you have a regulator, someone who likes regulations and likes forcing people to do stuff. He says, I'm going to force everybody, but to you, I'm going to give you a favor. I'm going to give you a free zone for a temporary time. And you can do whatever you want in this free zone. Well, almost whatever you want. But what happens is that, first of all, this man is using this to appear more pro-freedom, while everywhere else he is a regulator and he's a dictator and oppressor. And then in that free territory he's going to give you, he just wants your energy, your creativity to build it out, build it in, get investments coming into that area, build buildings, and then he's going to snatch it all away. And why I think so, why I'm so negative is because the dominating philosophy in the world is altruism. And the philosophy of altruism means that you expect other people to sacrifice to you, and that you have to sacrifice to someone else. So it goes both ways. And then if someone is successful, that's not good. That's considered selfish, and selfishness is bad. People think altruism is good, selfishness is bad. So if someone is successful, we have to penalize him. If he's collecting a lot of money through crowdfunding, we have to penalize him. Why is he collecting so much? Let's take 30% of that, 40% of that, 50% of that. Now the tax is 40, 50%, and the argument, what is the argument? Well, you have to pay your fair share. That's the argument. The argument is moralistic. There is a fair share. Everyone has to pay a share. So everyone basically is leveled out. And I don't think that originally maybe the idea of decentralized finance, escaping the regulation framework of the finance, it was kind of towards the free market and capitalism. But I think over the years, altruism won, and all that energy has dissipated. Now you have all sorts of people who are interested in utilizing this blockchain phenomenon, which I think is an interesting idea. It does solve some technical problems, but they are using it to their advantage. If you take, for example, let's take Balaji, the network state book that I'm reading. The advice there is that you can create all these communities that eventually will be able to get this territory. Well, what I find extremely dubious is that you could actually get that territory eventually. And then what is actually being campaigned here is really an IPO, that you can create a cryptocurrency that cryptocurrency, you slap on it a flag, you slap on it some idea, and say, well, buy this cryptocurrency, collect a bunch of money, and that money doesn't go anywhere. Uh, I
Can I just address
Go ahead.
this part, because I feel
Yeah.
I'm in that space. I know Balaji. I know Patrick Friedman, who introduced me to him,
Yeah.
grandson of Milton Friedman. And all these other guys, Brock Pierce, and I even helped to connect some of the libertarians to the government of Liberia, for example. Politicians now have a 6-year mandate. They just got elected recently. Politicians are looking to get investment. Liberia is one of the poorest countries in the world, so they are flexible and interested. They're open for business, right? So, having said that, there's democratic processes. Their government's very similar to the U.S. government. 3 branches, and they speak English, and there's direct flights to New York. So there's many good things that are familiar to investors, right? So that's a good part.
Yeah.
Anyway, what I'm saying is it's a dance of trying to attract investment. Remember when New York wanted to attract Jeff Bezos' Amazon and give them tax breaks, right? So, and then AOC said we shouldn't do that. Look, there's arguments on both sides, but what I'm saying that I'm sure about is the network state, some of them will have network effects, large network effects. And when you have a large group, people start taking you seriously, like the Rotary Club, or people had the Freemasons Society, or whatever, throughout history, right? They had all these things. And people start taking you seriously. So if you want to go buy land, I mean, in Israel, they had the Jewish Agency, which was funded by Quakers and many other Christians and Jews throughout the world, and they were buying land, like legally. Now the question becomes, what can you do on that land? And many people would build socialist kibbutzes and societies and plant trees, and they collectively lived. That was the
Yeah.
ideology of the time. So I don't know, but I can tell you that these kinds of movements will probably exist. I mean, Israel was founded like such a movement.
Right.
So
Well, it's a good example you gave with the Jewish Agency and starting building these kibbutzes. Is that because what Weizmann argued is that yes, you can invite investment into Israel, or you can say maybe build apartments, sell apartments, but the real value is in cultivation of land, because once you have that land, it gives you a national identity. Land is a different category. So he was arguing this. And I don't see in any of these current network state approaches, except what Asher is working on, the medical stuff, actual product, actual product that is, uh, driving this thing. Just saying things that libertarians are saying, that they want to create a network state for a non-aggression principle society, is, in my view, is very weak, because the non-aggression principle society based on non-aggression principle, if you just go to a chat room based on that environment, you'll see people arguing all the time. They have no basis of an agreement on anything, because it's just not a solid principle. It's not a solid
sorry,
way.
I don't want to cut in, but I just want to say very important 2 things, and then so one is there is no violence online. Another cool thing is when the network state starts online, no one is physically attacking anyone, right? Whatever disagreement, you may block someone, but there's not really, you may tarnish someone's reputation. Now that's one. The other thing is I know all these guys. I know a lot of the guys building charter cities and network states. I was literally in their house and I was meeting them, and look, I'll say this. They are looking for specific things, self-sovereignty in these countries. And these countries, the politicians have a problem giving them even those things. And I have
Yes.
to tell those countries, listen, it's literally they're just trying to build a small gated community. I mean, Prospera is not that big. You got to keep it in perspective, keep a sense of proportion. Gated community, they were shocked that like a person in the country would not be allowed to walk into their community. I
I'm
said,
shocked. I am kind of shocked about this, but let's not get sidetracked. Yes.
no, but every gated community, I'm saying, is like that. In a private property, right? You support private property, it's
I
already
do.
like that.
Yeah, but
Okay.
it's not.
Greg, real quick,
not
what's
the
going
gated
on in
communities.
Prosper? I haven't been there in like 3 years. Is there active medical treatments being given there?
In Honduras.
in Prospera, yeah. I guess at the Pristine Bay Beach Club,
So,
or
so here's what's happening. These guys, they want criminal law to be administered by the state. They don't want to take over criminal law because that's an even bigger problem and of contention. They just want civil law, and they were able to get Honduras to give them the ZEDEs, right? The ZEDE. It's more.
Yeah, sure, yeah. But if they set up a clinic, or like they actively doing medical treatments, or do they still have to go over to the other side of the island to that GARM clinic?
Well, that's the thing. They can't anymore because the ZEDE law has been declared unconstitutional.
I don't want to be a party pooper, but I predicted this several times. I was saying this. People said, no, you were no. I predicted this. And the reason I predicted this is because you cannot build a free society without having a strong foundation. And that will be my pitch. Read Ayn Rand. That's what you're missing. That formula is missing. The Ayn Rand objective.
When I was on the island in 2021, this was the very beginning. Obviously there was no Vitalia. There was when we were on the island, the mayor of the island got arrested in a sting operation, trailing like 2,000 kilograms of cocaine in a tanker truck, and like. I don't know much of what I want to say, but it was very bizarre because he got released like 2 days later. And after kind of doing some talking with some people around the island, they all said they thought he was innocent and that he was framed by the then president of Honduras, who is now in jail in the United States for drug trafficking. And I would say that I won't say Prospero was involved with it, but I think that type of stuff is probably why if it doesn't work out there, that's going to be the reason why.
But also, dude, like this is embedded in the international system. So, like I spoke to Patrick Friedman, the U.S. is probably gonna, depending on Trump, put pressure. There's laws where they protect investors, and like they're gonna. In other words, Honduras is on the hook for billions of dollars.
They had like a 50-year clause for Kuwaitis or something, which they then extrapolated out to everybody, and yeah, they filed like a $10 billion lawsuit. I hope it makes it for sure. I hope they make it.
I mean,
sometimes I think there's going to be some big coup, and they just need to take over the island and extradite it, from Honduras. But
now we're talking. See, I had Noam Chomsky when he was alive. He's still alive, but I had him multiple times on my show. We talked about these geopolitical things, and I could tell you, look, Honduras is used to be one of the most criminal a lot of murders, a lot of robberies. And next door, they had Bukele got elected in El Salvador, cleaned it up very quickly. And it became, according to him, I don't know if this is true, the safest place in the from the least safe to the most safe. And he also invested in Bitcoin. But he's a dictator. Look, the point is, these places are overrun by gangs. The gangs make money on drugs, drug smuggling. There's a drug war. It helps them and it hurts them. I don't know. These are the realities that the politicians have to deal with, and they can't clean it up. It's very hard to clean it up if you don't have absolute power. So, I'm just saying that's. And then, of course, there's the coups, right? The Americans, the United States make coups in all of these countries to build the Panama Canal, and they have control of that. They have, they made Panama, they encouraged Panama to secede from Colombia, I believe, in order to then make the canal, or I don't know, whatever. So, there's all these machinations, and amid that, you want to create medicine. So maybe it's possible. I don't know.
Guys, this has been a very great hour and a half almost. I'm going to summarize here, and I also invite you again to this YouTube show that I'm running here. My goal is to bring some of the Western subjects to a lot of Russian-speaking audience. I'm hoping to attract people who live in the States, who maybe like you or Greg know Russian, but you consume maybe most of your media in English because the stuff is just not available in Russian language. I want to change that. I mean, why is it that if why Russian people can only speak about Ukraine-Russia war, right? Why can't we speak about stuff that matters here? And that's my goal. So, Greg, we definitely have to meet again on this channel and talk about some of your Russian speaking background. Maybe you can speak Russian. I don't know how fluent are you. Yeah, and Asher, we'll invite you again later. I want to touch base on your progress with your exosome research. Hopefully, you will I be able to actually produce something that is closer to a product. And also, I think the idea of rejuvenation, this is the next big thing. It's the biggest thing that the internet ever was. This is going to change the world. I just don't know how soon it's going to happen. People tell me this is just around the corner. And I hope we learn about this stuff from you because you're the only expert I know on this topic.
Cool. Yeah. Thanks for having me. This was a fascinating discussion. We went really wide. I'd love to get together again and do it again and really try to work to synthesize some of these ideas a little more.